From Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about swallowing and speech issues related to head and neck cancers and how they're treated here at Sarasota Memorial. Our guest today is Ashley Long, a speech and language pathologist here at Sarasota Memorial. Ashley, thank you so much for being with us.
Thanks for having me.
As a speech and language pathologist, what exactly is your role with the head and neck cancer patient population?
Yeah, that's a good question. So here at Sarasota Memorial, we really strive to have a multidisciplinary approach. So with that, we have our doctors, our radiation oncologists, our medical oncologists, myself, dietitian, and nurse navigators. And my role with this is to help patients with their speech, their swallowing, and their voice as they go through treatment for these tumors located in their head and neck.
Do you see them prior to their cancer treatment? And if so, why?
Yeah, so I typically will see them in clinic with our surgeon, Dr. Vossler. I see them at time of diagnosis, and then ideally we see them prior to. And the reason for that is for education. Education is power, or knowledge is power. And so I go over things that could happen depending on their course of treatment. So some patients might have surgery, some patients might go through chemo and radiation, and it's really important for me to discuss what may happen or what may change with their speech and swallowing. It's also important to provide education for exercises that might help to reduce the effects of these treatments.
And I know head and neck cancer patients can have very different courses of treatment, yes, whether, as you mentioned, it's surgery or chemo or radiation or some sort of combination. But what are some of the most common issues with speech and swallowing that patients face after some of those treatments? Yeah,
so they will typically have issues with swallowing or could have issues with swallowing. Radiation will sometimes cause dry mouth, or even surgery could cause dry mouth. Changes in the way foods taste, reduced opening of their mouth, changes in their voice. And all of these can lead to a negative impact on their speech and swallowing, and therefore causing a negative impact on their emotional stability and how they perceive themselves going through treatment. So we also want to help with speech and swallowing, but it's our job also to listen to how they're feeling, how their emotions are, and how we can help guide them through this process.
So are there any exercises or therapies or at-home remedies you have people start before they receive their treatments, which can maybe help prevent some of these issues or lessen the symptoms?
Yeah, so when we first meet with the patient, I go over exercises to strengthen or preserve the strength of their swallowing function while going through treatment. Our body is made up of a ton of muscles, and we rely on these muscles to react and protect our airway when we swallow. We don't want things going down the wrong pipe, obviously. And so when going through treatment, patients are more likely for this to happen. And that can become risky, because if it gets into the lungs, it could cause them pneumonia and worsening pulmonary status. So we definitely introduce swallowing exercises to negate some of these issues while going through treatment.
So getting into the therapy for the most common issues you've discussed, let's start with dry mouth. I know you mentioned that is common with radiation.
Yes.
And it can also happen with chemo as
yes.
well, correct?
Mm-hmm.
So what do you most commonly work on with patients to help them treat the dry mouth?
So the dry mouth is as a result of the salivary glands being affected through treatment. And so unfortunately, there's no exercises that can prevent that or stop that. But I'm fortunate enough to have a really great team and past patients who have created a long list of suggestions that have worked for them, from biotin to things called Xylemelt. So different supplements, even acupuncture for some patients have helped. So it's not so much providing exercises that can help, but almost guiding them to what may help them or may improve their symptoms. Dry mouth is sometimes a lifelong thing that they'll always have to face to a degree, but just helping them learn their new normal and how to live with that.
Now, can it resolve itself after treatment is completed?
Yeah, so with treatment, as that treatment becomes more distant in the past, we expect patients to slowly improve on their own. Every patient is different, and so we can't guarantee how one might respond to radiation or chemo or surgery. And so we prepare for the worst and hope for the best, and typically encourage them to allow a few months after treatment so that some of those symptoms maybe resolve on their own or improve, and I obviously continue to help as needed, for sure.
What about some of the more maybe difficult symptoms patients might face? For example, tooth decay and gum disease, even difficulty swallowing altogether. Those can have more lasting impact on overall health, not just maybe discomfort.
Yes.
So how can a speech and language pathologist help with those symptoms?
Yeah, so prior to treatment, we encourage patients to meet with their dentist for a full oral exam. That's to ensure all the teeth and the gums and the bones are in good health prior to starting radiation. With regards to swallowing, you're right, that can be a huge impact on somebody if it declines throughout treatment. Again, it varies for every patient, and we have to be patient and encouraging for these patients to pursue these swallowing exercises and to pursue therapy while undergoing what could be the toughest time of their life, and guiding them. Some patients will end up needing feeding tubes because they need it to meet nutritional needs, and that's unfortunate, but that's where we come into play in our team approach, this multidisciplinary approach, working with the dietitians to make sure they're meeting their nutritional needs, and if they're not, how can we further help? Can we provide thickened liquids, moist solids, to help them continue to eat safely without this risk for aspiration?
Swallowing is something that we don't necessarily think about.
Right.
We do it all the time throughout the day.
Mm-hmm.
What are some of the exercises you might go through with patients? Because again, it's typically involuntary.
Right.
It's hard to think about not being able to swallow. I know we can't do a full session with you today, but what are some of the exercises that really help your patients?
Yeah, so first I want to start out and explain just the mechanism of swallowing and why that's important. And so in our body, we go from our mouth from one pipe to two pipes. The front way is our airway and the back pipe is our food pipe. Our airway is open at all times because we're breathing, right? So when we initiate a swallow, for a split second, muscles work and react and close our airway, and the swallow and allows all the food to go down the food pipe. Every once in a while, we drink our coffee too fast, we're distracted talking to friends, and things go down the wrong pipe. And that's not that big of a deal because it happens once all day, all week. But what we don't want that to happen is for patients to have that occur with every swallow, with every meal. That's when it becomes risky for things like aspiration pneumonia. And so that's why swallowing exercises are really important during treatment. We want to maintain the strength of those muscles. And so one of the exercises we give is called the effortful swallow, and we can do that one together. That one, you gently place your tongue on the roof of your mouth and just swallow hard like you're swallowing sticky peanut butter. You can start to feel some of those muscles engage more than you would in a normal swallow. Another exercise is called the Masako maneuver. For that one, you gently place your tongue in between your teeth and now swallow like that. And so that when you feel a little bit more, those muscles really reacting. And so for patients, swallowing every day during their meals is great, but doing these exercises gives those muscles a little extra boost so that maybe we can prevent any decline while undergoing treatment.
With the clinic at Sarasota Memorial and the multidisciplinary team that you have, how important is that relationship you develop with the patients and seeing them throughout their treatment? And have you seen that be a successful practice in helping patients maybe prevent some of these issues or stave some of the issues off a little bit?
Yes, absolutely. I feel that we are so lucky to have this multidisciplinary approach here at Sarasota Memorial now. From the doctors, the radiation oncologists, medical oncologists, nutritionists, and we have a nurse navigator that's dedicated just to this population, and all of our wonderful nurses across the system. I feel that this approach really helps us keep tabs on each patient, if you will, and so that we see them at the time, or I will see them, time of diagnosis. I give them pre-education. I see them halfway through their treatment if they're pursuing radiation. I see them at the end, and it varies and it will increase if they need more help. But with that team approach, I can easily reach out to our nutritionists and say, this patient's down a few pounds. When are they seeing you again? Or with our nurse navigator, hey, this patient was lost at follow-up. Can you follow up and check up with them? Even with the surgeon, I can easily call him and say, or send him a message and say, this patient has new concerns. Would you like to see them? And I feel that this approach and this multidisciplinary team is really beneficial for the team and the patients themselves. it provides much more success, in my opinion, for treatment, and people don't fall through the cracks. Sometimes we'll get patients who went through treatment and they never saw speech therapy. Whether or not I could have helped them throughout prevent swallowing issues, you never know, but at least they have the education beforehand and they can prepare, and family understands and they know when to ask more questions or what's to be expected.
And there are more members of your team, including other speech and language pathologists who help specifically with speech, because that can be impacted significantly as well.
Yes, I'm fortunate enough. In our office, we have other speech therapists who specialize with voice disorders. And so somebody's voice could be affected depending on where radiation might be targeted or where the tumor and cancer might have been located. And if somebody's voice changes, especially if they do what you do and they speak all day or they sing, that's really important to them. And I feel very fortunate to have these experts in the offices right next door. So if a patient not only is coming to me for swallowing, but starts to notice voice changes, I can easily pop my head over and ask them, or I can refer to them, and it can be this full speech language approach and targeting all aspects with the experts of each aspect, which is awesome.
Yeah. And do patients typically need your care long term after cancer treatment, or how often do they need to continue seeing you?
In a perfect scenario, I would see a patient beforehand, and then after, or midway through radiation, or after if it was surgery, and then at the very end of the radiation. In a perfect world, I wouldn't see them anymore much after that, because they would be fine and they would just call me on the holidays and I would never see them again. There's a small population of patients, because of the severity of their tumor and cancer, that they required a total laryngectomy. And those patients had their full voice box removed. In that, they require a small voice prosthesis to be changed so that they are able to communicate. These patients will see me routinely every 2 to 4 months for this to be changed. And for those patients, I will see them the rest of their lives, which I feel so fortunate to see my patients that I have so often, because you build such a close bond with them and relationship with them, their wives, their husbands. So that population I will see for the rest of their lives, but the rest of them, you hope that you don't see them again.
Do you ever have to prescribe or utilize pharmacologic interventions to help with some of like the swallowing issues or maybe loss of taste, as you mentioned before? Do you ever have to use medicine, or even is there a need for further surgical intervention ever?
So if somebody's having issues with pain while swallowing, I personally cannot issue any pharmaceuticals because I am only a speech language pathologist, but I will communicate with their team and say, this patient has a decrease in appetite. Can we just prescribe an appetite stimulant? They're having a lot of pain while swallowing. There's something called magic mouthwash that kind of helps with that pain and desensitizes it enough so that they can swallow safely and tolerable. So I definitely will utilize different things out on the market, but definitely go through their provider to prescribe those.
So what do you like most about working with this patient population? I know you've mentioned the follow-ups are great and developing those relationships, but what's so special about this particular patient population?
I love the bond that I develop with them. It makes me so happy to see them at the finish line and that they made it. Those highs and lows, you're there for them. So I don't know, it makes me emotional, but I really enjoy seeing these patients and helping. And sometimes I'm not so much helping them with swallowing, but I'm almost just an ear to listen to what they're going through, help guide them. You're not meeting your nutritional needs. How can we help? How can I add suggestions? Let me be your resource and get you through this, get you to the other side. It's hard for them sometimes to see that end goal. You're in week 4 of a 7-week treatment and you're feeling your worst. You're having radiation burns, you're down, you're not eating. And so it's really important for myself and other members of our team to continue to be their cheerleaders, that you can do this, you can get to the other side, and we'll all be there celebrating your victory.
You mentioned the clinic specific to this and having the multidisciplinary approach. That's all part of the Brian D. Jellison Cancer Institute. Sometimes these patients have other cancers as well. Mm-hmm. How important is it for your multidisciplinary team to be under the umbrella of the Brian D. Jellison Cancer Institute and have all of those oncologists who might specialize in different cancers as well in one area, under one roof, helping you treat these patients?
It's so important. I just see head and neck cancer patients, but these cancers can always come back, or they might develop a new cancer. And it's important to continue to have these experts all under one roof caring for all of our patients. It makes them very accessible to ask questions and provide the best care for these patients. And especially for the patients, they're going to one place. A lot of these patients travel a long way, a far ways, and for them to go all over town is sometimes hard. So to have it all under one place, I know that the patients love it. We love it.
So Ashley, before we go, if anyone else who is a patient, maybe with a head and neck cancer, or someone listening, watching has a loved one or a friend with head and neck cancers, what do you want them to know in relation to speech and language pathology?
Yeah, I think knowledge is power. So the more they know, the more they can be proactive in this journey. If they don't have a speech language pathologist on their team, definitely request one. Myself and my team, we're here in Sarasota, but there are wonderful speech therapists across the state of Florida and throughout the country that can help with these issues.
Is there anything else you want to add before we go?
Yeah, touching base on here in Sarasota, I'm fortunate enough to facilitate a patient-run support group. And so if anybody in the area is dealing with head and neck cancer, has loved ones going through head and neck cancer, know that we're here. They can join our support group by emailing SPUNC, so SPOHNCSRQ@gmail.com, and be included in our monthly emails, and join our support group via Zoom, and where we cover topics that are important to our patients, and it's led by professionals and patients.
And it's so important to have that sense of community
Yes.
when you're going through a diagnosis like this.
It's easy to feel alone, and that's what we want to prevent. We want to prevent people and patients and family from feeling alone and like they're the only ones experiencing this, because they're not. This is what we do all day, every day. So they're not alone, and there is help, and there are experts out here that want to help and want to be their cheerleaders.
Absolutely. Well, Ashley, thank you so much for joining us today.
Thank you.
As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.